Hello, my name is Dr. Donald Stater. I'm an addiction and emergency medicine clinician, and I'm the chair of Colorado's Cure. So let's begin with what Colorado's Cure stands for. It stands for Colorado's Opioid Solution, Clinicians United to Resolve the Epidemic. And here in Colorado, when it comes to facing the opioid crisis, we've decided that the best way to face it is together. And we believe that with all our medical specialties working in unison, we can go so much further than any of us could go alone.
So one of the things that we knew when we looked at maternal mortality data, or the reason that women were dying during pregnancy and after, we looked at that and we found we were doing a really good job of not letting women die during labor. But when we looked at the postpartum period, after moms went home with their babies, we found that that's when we were losing moms. We were losing moms because of things that were preventable: mental health disorders and substance use disorders. So this project became critically important to reducing the mortality rate here in Colorado.
For me as a hospitalist, I've seen a lot of people who come in with opioid use disorder and have never known really how to treat it. And I've seen lots of people who've come in and who've had surgeries, who've had failure to thrive because they're so enmeshed in taking their narcotics.
You see the effects of the opiate epidemic day in, day out. You want to do something about it. And we just can't do it as one specialty alone. We really need buy-in from everyone to do that. And so having a functional document involving multiple disciplines that's tailored to each specialty, I think is the way you at least make some headway, and just continue down that. I think that's the only way you can do it.
Through Colorado's Cure, our specialties will have access to some of the most forward-thinking guidelines in the entire country. Guidelines that really address how clinicians can holistically address the opioid epidemic in their practices. And that's around 4 pillars. Pillar 1 is limiting opioid use to where it's really necessary. 2 is using alternatives to opioids for pain control. 3 is harm reduction and how to keep patients safe while they're in the midst of their use. And 4th is the treatment of opioid use disorder, how we actually get our patients out of that cycle of continued and dangerous use into a life of recovery.
What's really great about these guidelines is it's getting the patient involved in their treatment for pain. So it's maybe sort of getting their buy-in and knowing that, for example, for migraine headaches or abdominal pain or musculoskeletal pain, we can provide key education to them about what's appropriate treatments for their disease states that in many cases include non-opioids.
Limiting opioid and choosing alternative non-opioid medications is what fascinates me with the latest development in science, in pharmacy, in medications, and in knowledge about pain. I was desperately looking for something that is evidence-based that I can use and still reap the benefits of the medications, but will also not cause any harm. And this is where this excites me, that I now have one-stop shop for everything, where I can decide what to give, how much to give, what to do to prevent from even using them if not needed.
I think a lot of dentists right now know about ibuprofen and Tylenol and the mix of that as being an effective way. But there are a lot of other ideas that came out of that I had never heard of. Things like preoperative dextromethorphan, preoperative gabapentinoids. Those were completely new to me. And while I think some of them it's going to take a while to get them into mainstream dentistry, we need some more research, I think that was pretty interesting. The other one was harm reduction. There was a concept that kind of floored all of us on our task force.
For me, one of the most impactful sections was harm reduction. And I think it was really eye-opening. One of the maybe seemingly controversial sections in our guidelines was just learning how to inject drugs. And it seems kind of odd to think like that, but when you're caring for these patients, you really need to kind of understand what they're going through. I never thought asking a simple question like, do you clean the skin before you inject, or do you have sterile water, would really change how these encounters go. But I've noticed, time and time again, people just opening up, and this is a population that really gets treated poorly, and I think there's a lot of judgment. And nothing has made me feel more proud than having a patient come back and say, I came back here because I was treated with respect. And so that means the world to me. I think that's a section that we often overlook, but personally for me was very novel when we first put these guidelines together.
It's the rare patient who comes in saying, hey, I have an opioid addiction. There's so much stigma around this. I think what's novel about this guideline for occupational medicine physicians is just planting that idea that if you're not aware of it, if you're not asking, if you're not screening patients, if you're not speaking in ways that are compassionate, you may be missing an opportunity to really change someone's life.
As physicians, we know that this is a lifelong learning process in our careers, and science is constantly changing. We're learning from each other, learning from colleagues, learning from science, from data. The nice thing about this initiative was that it was a collaboration of all kinds of specialists all over the state of Colorado with one goal, which is basically to improve patient care using less opioids.
It's patient-focused. It's really focusing on what is driving the troubles in substance abuse in our patients, and where can we meet them where they're at to be able to treat them the best that we can.
The opioid crisis continues to represent one of the largest public health disasters facing our nation. And it gives me so much hope that we in Colorado have come together and decided to work in unison to address this crisis. Together, I sincerely believe that we can make a difference and save lives. We'd like to end by thanking all the organizations that participated in Colorado's Cure: Colorado Medical Society, the Colorado Hospital Association, and the Colorado Consortium for Prescription Drug Abuse Prevention. And we'd like to thank the Colorado Office of Behavioral Health. Without your funding and belief in this project, none of this work would be possible. We are forever indebted and grateful to you.